Welcome to the deep dive. Today we're zeroing in on a really specific role in healthcare. It's not your typical data entry job at all.
But I'm close.
We're talking about the clinical coding trainer and advanced practitioner. Our mission really is to get under the hood and see why this position is so vital for, well, a hospital's financial health and staying compliant.
Absolutely. It's fascinating because this role, it's kind of the linchpin in the whole revenue cycle management process, the RCM.
RCM, right.
And we're not just talking admin here. This is serious risk mitigation. I mean, the real value add for this advanced practitioner is stopping those costly errors.
Especially the big ones.
Exactly, especially in those high DRG cases, the high acuity patients, those complex cases, they're like magnets for external audits, even severe regulatory heat.
Oof.
Yeah. One slip up there can cost the hospital millions, literally millions.
Okay, so let's unpack what makes this role so powerful. Our sources point to, like, 3 core functions rolled into one senior position. It's this combination of advanced technical coding skill, really stringent quality assurance and auditing, and then the vital training part, developing human capital.
That's it, exactly. The job fundamentally shifts. You're not just assigning codes anymore like a standard production coder does.
Right.
You're verifying them. This practitioner basically becomes an internal auditor. They need sharp analytical skills to spot systemic problems, inaccuracies.
And compliance red flags.
Yes, precisely.
Yeah.
Things like undercoding, which, leaves money on the table, or documentation habits that might unfortunately look like fraud. It's less about checking a single receipt.
And then more like
Auditing the entire supply chain, making sure every single cost actually lines up with the medical resources that were used.
Yeah. And that has direct, massive financial implications, doesn't it?
Oh, absolutely. This person ensures the hospital captures key clinical data points correctly, like severity of illness, SOI, and risk of mortality, ROM.
And getting those right feeds into the case mix index, the CM.
You got it. The CMI is crucial. Think of it as the hospital's financial X-ray. It directly measures how complex and sick their patient population is.
Yep.
If that calculation is off, the hospital isn't getting paid fairly for the complex care they're providing. That puts the whole organization in financial jeopardy.
That's a huge pressure point. So to do this high-level analysis, they must need some serious expertise. What are we talking about here?
Serious expertise is, maybe an understatement. It demands advanced skill in really complex medical areas, understanding the fine points of oncology, say, or critical care. Plus, comprehensive facility coding knowledge, that's your ICD-10, CMPCS for inpatients, and also CPT, HCPCS too. And importantly, the credentials matter. A lot.
You mentioned the CCS certified coding specialist being foundational, maybe preferred over the CPC, the certified professional coder. For someone listening who might have a CPC, what's the functional difference that makes CCS so key here?
That's a really important distinction. The CCS credential drills down hard on inpatient facility coding and that PCS procedural system.
Which is the complex part.
That's the most complex bit of hospital coding, It's what drives the CMI calculation. The CPC is excellent, don't get me wrong, but it's more focused on physician or outpatient billing.
Okay.
It doesn't quite show that deep mastery over the whole hospital picture, which is exactly where this advanced practitioner is focused, mitigating that high-dollar risk.
Got it. So massive financial stakes. But avoiding that risk only works long-term if the knowledge gets passed on properly, right? Which brings us to the training part.
Correct.
Why does teaching this stuff need something like the 4-component instructional design model, the 4CID? Can't people just shadow an experienced coder?
Well, simple shadowing often isn't enough, not when tiny documentation ambiguities can blow up into major audits. The 4CID framework, it ensures training isn't just, reciting rules.
It's more structured.
It's structured learning tied directly to complex, real-world clinical tasks. That specialized teaching skill is vital for getting the knowledge to stick and cutting down errors across the whole coding team.
And they also do CDI, Clinical Documentation Integrity.
Yes. They act as a critical go-between. They perform CDI, querying doctors and nurses to clear up fuzzy documentation before a code gets locked in. They're basically closing potential loopholes preemptively.
Okay, so that dual expertise instructional design plus compliance oversight, that must be highly valued in the market. The salary numbers seem to back that up.
They absolutely do. The data shows a clear premium for people who can effectively teach complex rules and ensure compliance.
What are the numbers?
The average salary for an AAPC-approved instructor hits around $97,070. Compare that to the median for a general medical records specialist, which is about $67,680.
Wow, that's nearly a $30,000 difference.
Exactly. That gap really underscores the monetary value placed on mastering effective knowledge transfer and proactive compliance. It's a big deal.
So, boiling it all down, this advanced practitioner trainer role, it's like the ultimate bridge, isn't it?
It really is.
Connecting complex clinical data, the hospital's bottom line, and all those regulatory hoops they have to jump through. They protect revenue by lowering risk through better education internally.
Which leads to a final thought, maybe something for you, the listener, to consider. Given how much more the market values this instructional skill, that $30K premium, should healthcare organizations maybe mandate formal training and instructional design for all their senior compliance staff?
To guarantee that knowledge transfer is effective.
Exactly. To ensure it's effective, systematic, and maybe even helps reduce costly staff turnover in these critical roles. Something to think about.